Welcome to The Q. I'm Nurse Bug. This is News This Week in Nursing Homes. First up, notice of upcoming skilled nursing facility quality reporting program measure removals. SNF providers should be aware of upcoming measure removals from the SNF QRP. The following quality measures are planned for removal from the IKEYS, Review Correct, facility level quality measures, and resident level QM reports in January 2024. The first is the percentage of LTC hospital patients with an admission and discharge functional assessment and a care plan that addresses function. The second and third are the application of IRF functional outcome measures of change in self-care score and mobility score for medical rehab patients. Starting with the October 2024 release, measures will be removed from the Care Compare and Provider Data Catalog. Once removed, historic publicly reported measure data will be available in the archive files on the Provider Data Catalog. You can find more info on these changes at cms.gov. Next up is the news report from the CDC addressing COVID-19 Rebound. The CDC recently released 2 reports in the Morbidity and Mortality Weekly Report about the association between COVID-19 Rebound and receiving antiviral treatment, finding that COVID-19 rebound can happen whether a patient receives antiviral treatment or not. A person's risk of experiencing rebound could be related to a range of factors, such as immunosuppression, delayed viral clearance, or overall immune response. The CDC concluded that the benefits of COVID-19 antiviral treatment for reducing the risk of severe illness, hospitalization, and death outweighs any potential risk. The 2 studies can be found at cdc.gov. Updates to weekly COVID-19 vaccination reporting for LTC healthcare personnel. Facilities need to take note of the vaccination reporting form changes implemented for Q1 of 2024, beginning January 1st. The form has been simplified with the following changes. The question on HCPs completing the primary series has been removed and reflects the latest guidance from the CDC and FDA. Changes to the HCP form ensures that the HCP and resident forms align with the required COVID-19 vaccine reporting. See a full list of changes at cdc.gov. Now let's talk about 4 tips to improve Section GG coding accuracy. The LTC Facility Resident Assessment Instrument 3.0 User Manual, or RAI, specifies facility staff must assess resident self-care performance based on direct observations, incorporating resident self-reports, and reports from qualified clinicians, care staff, and family documented in the medical record during the assessment period. 4 tips to help facilities develop a process to ensure accuracy of Section GG include: Tip 1. Distinguish between data collection and determination of usual performance. Tip 2. Involve the IDT. To achieve comprehensive understanding of a resident's performance, observations must include multiple instances, circumstances, and locations. Tip 3. Don't rely on only one staff member to complete Section GG. Limiting data used to determine usual performance to just one discipline or staff member prevents Section GG from presenting a holistic view of the resident's performance during the 3-day window. Tip 4. Remember the clinical judgment of qualified clinicians as part of the process. Coding Section GG can be challenging, and attempts to oversimplify will likely result in an incomplete eval of usual performance and inaccurate MDS assessment. For more information, review the RAI manual at cms.gov. Another interesting issue is called Labor Department Issues Independent Contractor Final Rule. The Department of Labor issued a final rule that will change how senior living communities determine who's an employee and who's an independent contractor, effective March 11th of this year. The misclassification of employees as independent contractors may deny workers minimum wage, overtime pay, and other protections. This final rule will reduce the risk that employees are misclassified. The rule has not been published in the Federal Register yet, but is available as a PDF at public-inspection.federalregister.gov. And finally, Tennessee nursing homes. The Tennessee Department of Environment Conservation proposed changes to the medical waste definition. Chapter 0400-11-01 defines medical waste as the following. The previous definition was waste generated by hospitalized patients isolated to protect others from communicable diseases. The new definition states waste generated by hospitalized patients isolated to protect others from diseases caused by pathogens. Pathogens are microorganisms, including bacteria, viruses, parasites, and fungi, and other agents that can cause disease in human and animals. The public comment period is open until Friday, 1/12/24, and Tennessee nursing homes can submit questions and concerns to jeremy.hooper@tn.gov. Thanks for joining me for News This Week in Nursing Homes. And remember, for all of your healthcare and quality improvement needs, call the Q.